When was the last time that you checked your blood pressure? You probably did it all the time in Publix when you were a little kid, but how about now? As an adult, 1 out of every 3 Americans have high blood pressure. There is a reason why professionals call high blood pressure a silent killer. High blood pressure puts you at an increased risk for heart disease, kidney failure, heart failure, and stroke, among other things. The primary way that high blood pressure causes harm is by increasing the workload of the heart and blood vessels, making them work harder and less efficiently. Here are 8 complications that can arise from high blood pressure. Number 1, it raises your risk of heart attacks and stroke. High blood pressure damages the delicate tissues inside the arteries. This makes them more likely to develop deposits of plaque that harden, narrow, or block your arteries. This can lead to blood clots that may lead to a heart attack or stroke. Number 2, it makes you more likely to develop heart failure. When your arteries are hardened or narrowed, your heart has to work harder to circulate your blood. This may cause your heart to become larger and fail to supply the organs with blood. Number 3, you may experience chest pain. Chest pain, also known as angina, occurs when the heart does not get enough blood it needs. When people with high blood pressure perform activities such as walking uphill, going up steps, or exercising, angina can cause pressure, squeezing pain, or a feeling of fullness in the chest. Number 4, it can cause kidney damage. Your kidneys help your body get rid of toxins and regulate many of your body's complex functions. High blood pressure can cause damage to the arteries, which may reduce their ability to do their job, and at worst lead to kidney failure. Number 5, you are more likely to develop vision problems. The small blood vessels in your eyes can easily be strained or damaged by high blood pressure. It can also cause swelling of your optic nerve, so high blood pressure left untreated may cause permanent vision loss or impairment. Number 6, you could develop sexual dysfunction. High blood pressure can cause low libido in women and erectile dysfunction in men. Number 7, it raises your risk for a peripheral artery disease, also known as PAD. PAD occurs when the arteries in your legs, arms, stomach, or head become narrowed and cause pain, cramping, and fatigue. If you have PAD, you also are at increased risk of a heart attack and stroke. And number 8, you have a higher risk of a hypertensive crisis. A hypertensive crisis is a medical emergency that causes your blood pressure to rise above 180 over 120 rapidly. If your blood pressure gets too high, it can damage your organs and other potentially life-threatening complications. So you ideally want to aim for your blood pressure to be around 120 over 80. So take your blood pressure today. If it is above normal, I recommend you maybe changing your diet, but definitely speak to your primary health provider.